Welcome to The Explainer. Today, we're jumping into a topic that honestly affects millions but doesn't get talked about enough: sexually transmitted diseases. We're going to pull back the curtain on what's been called a hidden epidemic, using insights from a top medical textbook. And most importantly, we'll talk about what you can actually do about it.
All right, so first things first, why are experts calling this a hidden epidemic? Well, it's because the numbers are kind of staggering. They paint a picture of a problem that is way, way bigger than most of us think.
So to really set the stage here, let's just ask a straight-up question. How many adults in the US do you think have an STD right now? Take a guess.
Get ready for this. The data shows it's about 1 in every 5 adults. 1 in 5. Think about that. You're in a room with 4 other people. Statistically, one of you is living with an STD. That really puts it into perspective, doesn't it? And you know what's wild? This isn't some new thing. We're talking decades ago. A major report from the Institute of Medicine was already calling STDs hidden epidemics. And the really scary part? That warning is just as urgent today. Okay, but here's what's really got public health folks worried. Some of these diseases, ones we thought we had a pretty good handle on, well, they're making a major comeback. A huge one. We're not just talking about new stuff. Old infections are roaring back. I mean, just look at these numbers. They're pretty shocking. Since just 2016, the rate of syphilis has shot up by 52%, and gonorrhea up 45%. These are massive increases, and it's happening for a whole bunch of reasons. Everything from changing social norms to our public health systems being stretched super thin. And it's not just the impact on people's health, right? There's a huge economic cost, too. We're talking almost $16 billion every single year. That's just the direct cost of treatment in the US. Okay, so that's the big picture. It's a lot. Now let's zoom in and make this personal. Because the very first step in protecting yourself is knowing where you stand, what your personal risk looks like. And luckily, there's a really simple framework for that. Healthcare providers use this great tool called the 5 Ps to have an open, non-judgmental chat about sexual health. It's super straightforward. You've got partners, to know about potential exposures; practices, meaning what kinds of sexual contact; protection, as in are you using condoms or other methods; past history of STDs; and finally, pregnancy intention. It's just a really smart, thorough way to map out personal risk. All right, so understanding your risk, that's step 1. But step 2 is knowing what to do with that information. And that's where the prevention playbook comes in. These are strategies that we know actually work. So the CDC has this 5-part strategy, and it's pretty brilliant because it creates this whole public health loop. It all starts with accurately assessing risk and good counseling. Then you move to proactive stuff like vaccines and screening to find infections early. And once you find something, it's all about effective treatment, not just for the person, but, and this is so important, for their partners too. That's how you break the chain of transmission. Now let's get practical for a second. Condoms. They're still one of the absolute cornerstones of prevention. Used the right way, every time, they can slash the risk of HIV transmission by around 80%. And yeah, people worry about them breaking, but the actual rate is super low, like 2 out of every 100. Just remember this pro tip. Never use oil-based lubricants with latex condoms. They can cause them to break down. Stick to water or silicone-based only. But it's not just about barriers like condoms. We have some seriously powerful medical tools in our arsenal now. I'm talking about pre-exposure vaccination, which is a total game changer. The HPV vaccine is the perfect example. Just think about it for a second. This is a vaccine that prevents the single most common STD and the cancers that it can cause down the road. That's incredible. Which leads us right into the next huge strategy: screening. This is so important because a lot of STDs don't have any symptoms at first. You could have one and feel totally fine, so you can't just wait to feel sick. That's why the guidelines are super specific about who needs to get tested and how often. For instance, for all sexually active women under 25, the recommendation is crystal clear. Get screened for chlamydia and gonorrhea every single year. No exceptions. It should just be a routine part of your annual checkup. And it's a similar story for anyone who's pregnant. Screening is absolutely critical. We're talking about testing for HIV, syphilis, and hepatitis B right at that first prenatal visit. It's all about protecting both the parent and the baby. Okay, so let's quickly spotlight a couple of the most common infections out there. Because honestly, understanding what these are and knowing that they are treatable is a huge part of fighting the stigma that stops people from getting help. So, let's start with chlamydia. This is actually the most reported infectious disease in the entire US, especially for people under 24. And here's the kicker. It often has no symptoms at all. That's why that annual screening we talked about is so crucial. If you let it go, it can lead to some serious problems. But the really good news, it's easily cured with a simple course of antibiotics.
Now, gonorrhea is a slightly different story. It's also curable, which is great, but the big challenge we're facing now is antibiotic resistance. Basically, the bacteria is getting smarter and tougher, which means some of our go-to drugs aren't working as well as they used to. It just makes getting diagnosed and treated the right way, right away, more important than ever.
And this is a great example of why knowing the signs can be so helpful, even if you should always see a doctor. Different infections can look pretty different. For example, the very first sign of syphilis is often a single sore, called a chancre, that's usually painless. But genital herpes? That typically shows up as a cluster of small, painful blisters or ulcers. See the difference? So we've looked at how big this problem is, how to figure out your own risk, and all the tools we have to prevent and treat these infections. When you boil it all down, it really comes back to one core idea.
Look, if you take away just one thing from all of this, let it be this. Yes, STDs are incredibly common. But, and this is a big but, they are not inevitable. Not at all. With the right information and by taking the right steps, they are largely preventable and almost always treatable.
So, we've given you the playbook, the facts straight from the experts. But knowledge is only powerful if you use it, right? So we want to leave you with a question to think about. After hearing all this, what's one single step you can take, starting today, to take control of your sexual health?